Ever wondered how crucial bone health is to your overall well-being? Well, let's take a journey into the fascinating world of our skeletal system to find out. Bones are the unsung heroes of our bodies. They provide structure, giving us our shape and posture, but they're not just rigid sticks holding us upright, they're dynamic, living tissues. They protect our vital organs like a knight's armor, shield the heart, brain, and other organs from injury. They anchor our muscles, acting as levers for movement. But that's not all. Our bones also serve as a storage bank for calcium, a mineral essential for various bodily functions. Now here's an interesting fact. Your bones are continuously changing. It's like a renovation project that's always underway. New bone is made and old bone is broken down. When you're young, your body makes new bone faster than it breaks down old bone, and this increases your bone mass. Most people reach their peak bone mass around the age of 30. After that, bone remodeling continues, but you lose slightly more bone mass than you gain. If you're wondering why that matters, here's the kicker. The higher your peak bone mass, the more bone you have in the bank, and the less likely you are to develop osteoporosis as you age. Osteoporosis is a condition that makes your bones weak and brittle, increasing the risk of fractures. It's like having a bank account where more money is withdrawn than deposited. Over time, you risk running out of funds, or in this case, bone mass. So you can see maintaining bone health is essential not just for your current well-being, but for your future health too. It's about making sure your bone bank balance stays healthy. And just like saving money, the earlier you start, the better. But remember, it's never too late to start caring for your bones. So let's explore how we can do that in the upcoming scenes. But what exactly influences our bone health? Well, there's a myriad of factors that can impact the health of our bones. Let's take a closer look, shall we? Firstly, diet plays a pivotal role. If your diet is low in calcium, for instance, you might find yourself with diminished bone density, early bone loss, and an increased risk of fractures. That's because calcium is a key building block for our bones. Next, physical activity, or rather the lack of it, can also affect your bone health. Those who lead a sedentary lifestyle have a higher risk of developing osteoporosis compared to their more active counterparts. So, getting moving is essential for maintaining strong bones. Now, let's talk about lifestyle choices. Research suggests that tobacco use and excessive alcohol consumption can weaken your bones. In fact, regularly having more than one alcoholic drink a day for women, or 2 for men, may increase the risk of osteoporosis. Your gender is another factor. Women, because they have less bone tissue than men, are at a greater risk of osteoporosis. Body size too plays a role. Those who are extremely thin or have a small body frame might have less bone mass to draw from as they age, placing them at risk. As we age, our bones naturally become thinner and weaker. Therefore, age is another factor that affects bone health. Race and family history are also important. If you're white or of Asian descent, or if you have a parent or sibling with osteoporosis, your risk increases. Hormone levels can also influence bone health. Too much thyroid hormone can cause bone loss. In women, bone loss increases dramatically at menopause due to dropping estrogen levels. In men, low testosterone levels can cause a loss of bone mass. Certain health conditions and medications can also affect your bone health. Conditions that affect your body's ability to absorb calcium, such as celiac disease, or long-term use of certain medications like corticosteroids, can damage your bones. So there you have it. Many factors can influence the health of our bones. Awareness of these factors is the first step in managing our bone health. Now let's delve deeper into 2 key elements: calcium and physical activity. Calcium is a superstar when it comes to bone health. Imagine it as the bricks in the towering structure that is our skeletal system. Our bones store calcium, and when the rest of our body needs this mineral for various functions, it dips into this calcium bank. That's why maintaining a diet rich in calcium is so vital. If we don't consume enough calcium, our bodies start to borrow more from our bones than they can afford to lose. This can lead to diminished bone density, early bone loss, and an increased risk of fractures. Dairy products, leafy greens, fish with edible bones. These are all excellent sources of calcium. But what's a superstar without its sidekick? Enter physical activity. Regular exercise, particularly weight-bearing and muscle-strengthening exercises, is a proven booster of bone density. It's like adding more bricks to our bone structure, making it stronger and more robust. Physical activity is not just about strengthening bones, but also about anchoring them. Our muscles play a crucial role in keeping our bones in place. The stronger our muscles are, the better they can support our bones. So, when we engage in physical activity, we're not just doing our hearts a favor, but our bones too. Of course, it's important to remember that all physical activity should be undertaken with care. Overdoing it or not using proper form can lead to injuries. So, always consult with a healthcare professional or a trained fitness instructor before starting a new exercise routine. Now, let's not forget that the presence of calcium and the habit of physical activity are not just standalone factors. They work together, in synergy. Regular exercise helps improve our body's ability to absorb calcium. So by being physically active and maintaining a calcium-rich diet, we can maximize the health benefits for our bones. Indeed, calcium and physical activity are the two key soldiers in the army defending our bone health. But what about the enemies of bone health? Let's talk about tobacco, alcohol, and certain medications. These substances can pose significant threats to our bone health, often in ways that aren't immediately obvious. Tobacco, for instance, is a well-known culprit. Research indicates that tobacco use can contribute to weakened bones. This is because tobacco interferes with the function of cells responsible for bone health, leading to decreased bone density. Smokers are found to have lower levels of bone mass compared to non-smokers, making them more susceptible to fractures and other bone-related complications. Alcohol, too, can be problematic when consumed excessively. Regularly consuming more than one alcoholic drink a day for women or two for men might increase the risk of osteoporosis. Alcohol can inhibit the body's ability to absorb calcium, a key nutrient for bone health. It can also disrupt the balance of hormones that help regulate bone mass, leading to bone loss. Now, on to medications. Certain long-term medications, particularly corticosteroid drugs like prednisone, cortisone, prednisolone, and dexamethasone, can be damaging to bone health. These medications can reduce the body's ability to rebuild bone tissue, leading to a higher risk of osteoporosis over time. Additionally, some drugs used to treat conditions like breast cancer, depression, epilepsy, and acid reflux have also been associated with an increased risk of osteoporosis. But it's not all doom and gloom. The first step in protecting our bones is being aware of these risks. If you're a smoker, consider seeking help to quit. If you drink alcohol, do so in moderation. And if you're on a medication that could impact your bone health, talk to your healthcare provider about potential alternatives or strategies to mitigate the risk. Remember, our bones are not just inert structures. They're living, dynamic tissues that require care and attention. And while we can't control all the factors that affect our bone health, we can certainly make choices that support their well-being. Being aware of these risks helps us make informed decisions about our lifestyle habits. So, how can we protect our precious bones? The answer lies in a combination of diet, lifestyle, and regular checkups with your healthcare provider. Let's start with diet. Make sure to include plenty of calcium-rich foods. Calcium is the cornerstone of strong bones. Adults aged between 19 and 50, and men up to 70 years old should aim for 1,000 milligrams per day. This bumps up to 1,200 milligrams for women over 50 and men over 70. Dairy products, leafy green vegetables, and calcium-fortified foods such as cereals and orange juice are all excellent sources. But calcium isn't the only player. Vitamin D also plays a vital role in bone health as it helps your body absorb calcium. Foods like fatty fish, cheese, and egg yolks are great sources of vitamin D. You can also get vitamin D from basking in the sunshine, but remember to protect your skin. Next, let's talk about physical activity. Regular exercise is a key factor in maintaining bone health. Weight-bearing exercises such as walking, hiking, jogging, tennis, and even dancing can help build strong bones and slow bone loss. Strength training is also beneficial as it helps to stimulate bone growth. Steering clear of tobacco and limiting alcohol intake are other important steps. Both tobacco and alcohol can contribute to weak bones and increase your risk of fractures. So, it's best to quit smoking and limit alcohol to no more than 1 drink a day for women and 2 for men. Lastly, always discuss medication use with your healthcare provider, especially if you're using long-term corticosteroid medications or other drugs that may increase the risk of osteoporosis. They can help assess your risk and suggest alternatives or supplements to mitigate possible bone loss. Remember, these tips aren't just for those at risk of osteoporosis. They're for anyone who wants to ensure a strong and healthy skeletal system as they age. Remember, your bones are the foundation of your body. Take care of them, and they will take care of you.